We are live.
9:30.
Over to you, Dr. Mohanty, sir.
Okay. We are live.
Okay. So, good evening, dear friends. Greetings from Bombay Orthopedic Society, and welcome to third episode of BOS Technopod course. Now, as you know, the first episode was devoted to the credit cards and the fraud and all these things, and second episode was devoted to different aspects. It's not all about orthopedics; it's all about how to be a complete man. And today, the third edition is devoted to record keeping. And Dr. Mahesh Kharde and Dr. Neeraj Bijlani have left no stone unturned to make it a very successful one. Three eminent speakers are there today, and all three are, the esteemed alumni of KEM Hospital. And senior most, Dr. Mangal parihar, he needs no introduction. He is the director of Center for Limb Lengthening and Limb Reconstruction, and he has got more than 30 years of experience of about limb lengthening, reconstruction, and as well as he's an expert in joint replacement as well. And he was our RJ Katrak orator, which was given in 2019 YRF, and all of us have listened to an excellent oration. And next, Dr. Mahesh Kharde himself, who is a practicing orthopedic surgeon at BIRAR, and he is the webmaster of Bombay Orthopedic Society as well. And he's a great interest in technicality and designs so much and does so much for Bombay Orthopedic Society. We are really grateful to him. The third speaker is Dr. Swapnil Keny, is our honorary secretary of Bombay Orthopedic Society. Is a practicing consultant pediatric orthopedic surgeon at Sion, as well as is a consultant at Apollo Hospital, Navi Mumbai, and he is a associate professor at Astu Sir JJ Group of Hospital. And we have Dr. Siti Chaudhary with us, who's a consultant spine surgeon, and as well as is a webmaster of Bombay Orthopedic Society. So without wasting any time, let me hand over to the convener, Dr. Mahesh Kharde, to proceed on with the program today. Over to Dr. Kharde, please.
Thank you, sir. We start the third episode of Technopod, record keeping. I invite now Dr. Swapnil Keny to start his talk. Swapnil, go ahead. Swapnil, unmute.
Swapnil, mute hai.
Swapnil, unmute.
Right. So this is what happens when you've been working the entire day and you start speaking and then you realize that you're muted. Very, very common thing happening. So I just said that I'm very thankful to Dr. Mohanty, Dr. Mahesh Kharde, Dr. Neeraj Bijlani, and Dr. Kshitij Chaudhary for starting this initiative and taking it till here. I'm pretty certain that in the time to come, we shall have more such webinars on interesting topics. Now, my tryst with electronic record keeping actually started in the year 2005 when I went for a pediatric orthopedic fellowship to South Korea. There I was really fascinated by the technology. In my hospital where I used to work in the room which was allotted to the fellows, the speed of the internet was about 100 Mbps, which was unheard of in India at that time and even today. And the hospital internet speed was almost 1000 Mbps. And what I realized is that those electronic medical records, which at that time were actually scanned records which were entered into the computer, helped us to write multiple manuscripts which ended up being published as papers. So that was the only advantage I saw of it at that point in time. But over the last 15 years, I have realized that there is much more to electronic medical records than just publications. Now, why do we need electronic records? The most important reason why we need records is that records get destroyed, records get lost, records get misplaced, and not only is it a great loss to the academic community, but even they provide us with evidence of a legal status, ownership of accounts, and also the particulars of obligation which an individual or a society or an hospital would have in those records. Now, electronic records essentially are those which are either made on a computer or simply they are made by scanning a piece of paper. They may be texts, they may be graphics, data, audio, pictures, or any other form of representation of data in a digital format that is created, modified, maintained, archived, retrieved, or distributed by a computer system. And it is not just a collection of data, but many a times it's a consequence of the data which is being saved or which is being stored. Now, word processors, spreadsheets, emails, CAD designs, web publishing tools, all are different ways in which you can actually create records. Electronic medical records, on the other hand, is a set of comprehensive databases used to store and access patients' healthcare information. It is seen as a virtual file or a virtual compilation of non-redundant health data across the lifespan of a person. Now, if you have a person who's coming to you with a file which is almost 300 pages, vis-a-vis you're seeing a patient and only seeing the relevant investigations and the relevant records, that is what essentially an EMR helps you to do. So this includes facts, observations, interpretations, plans, actions, and outcomes. EMR needs to be supported not only by a computer, but by a network of systems that captures, stores, processes, communicates, secures, and presents information from multiple different locations as per requirement. Your images may be saved somewhere else, your text may be saved somewhere else, your graph may be saved somewhere else, but just at a press of a button, all of them are integrated and everything comes to you on one single screen. This system facilitates the interaction amongst multiple specialists or even among the initial doctors and the later attendants, and also lets business administrators access these records for risk management assessment and for billing. EMRs allow medical personnel, that is doctors, nurses, fellows, residents, to go across histories without having to really search large databases. And the use of document imaging system, which is essentially called as PACS, which Dr. Mangal Parihar would probably be speaking on, can help you actually catalog. And this cataloging can help you classify the various conditions in which you have, for example, you have a lumbar canal stenosis. And if it is cataloged as LCS or lumbar canal stenosis, you can pull up all the patients you've done in the last 20 years, have a kind of an audit, and also try to publish it if you wish to do so. Now, these records are essentially classified as those which are vital, important, useful, and non-essential. Vital records essentially are the case sheets, which are very, very important from the academic point of view, clinical point of view, but also from the legal point of view, because these are essentially the assets which you hold, which is of interest to the organization, association, individual, or even a hospital and its shareholders. And these are essentially irreplaceable because this is your leverage based upon which you can have all the information you wish to compile for multiple reasons. There are other important types of data which are records, which though they are lost can be replaced, but take a considerable period of time to have replaced and may also incur some sort of a cost. These are essentially tax ledgers and financial statements. The third are useful records, which are essentially the numeric records, the loss of which may cause some amount of inconvenience, but these are essentially not really required for the day-to-day operations and only required when there are audits. And the last and the non-essential records essentially are about addresses, telephone numbers, destruction of which really doesn't cause you much of a problem because your legal status is not really affected by these. Now, there are many, many advantages of an electronic medical record system vis-a-vis a written or a handwritten system or a physical system. It is very convenient to use. You actually can access data which was 5 years old, 7 years old, 10 years old. If you're given some certificates, you can pull them up. And this happens very commonly in medical legal cases when you need to give certificates again and again, when you need to reproduce certificates. The patient has probably moved on, but the police constable keeps coming to your clinic all the time. And if you have this record, it becomes very, very easy for you to access the records of the patient and give these kind of certificates or information. It is a very, very organized form of information. It gives access to multiple users, and it really improves the efficiency of data collection, data management, and data retrieval, which may be very, very important when you are trying to publish data. There are certain disadvantages, essentially high investments. There can be errors, and one single error in a system can have a significant impact, and this can really cause a problem if that error is replicated by multiple people. It just keeps coming again and again. And there can, of course, be failures of hardware and software, which we faced initial period of time, but now that doesn't seem to be the case. With the Digital India platform coming on, these things are kind of getting more redundant. There are certain challenges at the beginning. Essentially, it takes a lot of time to convert your paper records to electronic records because of standardization of office procedures. Your staff needs to understand what exactly needs to be done, what is each task. The transition period can be anywhere between 12 to 18 months. So the productivity of your staff can be much of a problem. And there is time involved and there is cost involved. And if there are various different healthcare groups, or if it's a takeover, it can really be a challenge between two systems. To marry and match the systems can be a significant problem. So to conclude today's talk, the introduction of electronic medical records has seriously influenced the management of patient data systems in filing, chart tracking, retrieving, sharing data, essentially medical records. Once the medical records are in electronic formats in any of the operating system, healthcare information becomes very, very easy to access. Electronic medical records allow concurrent access of the data to multiple users at multiple different remote locations. Most importantly, it helps saving physical space of hospital, because in today's day and age, it is very difficult for a hospital to have such a big storeroom. When you move towards an HMIS environment, it is a very efficient and accurate environment which helps to maintain data in a very innovative manner. The patients can also take the benefits because it improves their safety and also prevents regular repeat of tests. And having an essential EMS system, that is the EMR system, will not only allow people to access these data simultaneously, but will help everyone in not only accessing but using this record for the benefit of the patients as well as for the system and for the society and the hospital. Thank you very much.
Thank you, Swapnil. That was a nice brief overview of electronic medical records. We move on. I'm the next speaker. So today my talk is about making OPD paper and records, of course, using Pages application on Mac. Windows users need not get disheartened. They can use the Word application, Microsoft Office Word application in Windows to make the same OPD paper. Of course, the tools will be a little bit different, but the basic concept remains the same. So we begin. The Pages say we start with a blank paper. I'll just zoom it. Okay. As we go along, I'll show you not only how to make the template for the Pages as the OPD paper, but I'll also show you certain tricks which can be used on Mac as well as Windows, and some extra points regarding how to enhance the speed of your work by using certain keyboard shortcuts, text expanders, lot of other things. So pay attention. Basic concept of making an OPD paper is based on the guidelines given by Maharashtra Medical Council and the Medical Council of India. Those who are outside Maharashtra should refer to their own state's medical council. Primarily, I think everything will be the same, but some few changes may be there. So follow those guidelines of making an OPD paper. So the OPD paper should essentially be having 4 parts. One is the doctor's details, name, degrees, address of the hospital, telephone number. Second part should be the part of patient's information, patient name, age, address, comorbidities. That. Third part is where the patient's history, examinations, findings, investigations, treatment, everything is written. And the fourth part is a small part, it is part which is to be used by the chemist, the pharmacist, if they want to mention whether the patient has taken full dose of medicines purchased or it's generic or not. But that is their point. So if you take this as an OPD paper and to begin a template, the upper part is usually occupied by the printed format for the doctors. So that comes as a letterhead. So name of the doctor, the degrees. So that part we really need not make anything today. Our work starts actually in the second part, the patient's part. Okay. So to get the cursor down here, because say the first 3, 4, 6, 7 centimeters will be for the doctor's part. So here we go with the cursor. So click on document. Put this as say 7 centimeters. Press enter or return, and the cursor falls here. Okay. Now here we make the patient's information chart. So we take a table, select this, just increase to say 7, 8, adjust from here. To delete this alternate dark and light shades, we can go to document, format, deselect this, and we get a uniform chart. Okay, so now we fill here the patient's data. Like name, age, sex, weight, address, date. Here you can have phone number, allergies, comorbidities. Just expand this to get everything in one line. Here you can have the occupation. Increase one column more. Here you can put the serial number. Okay, and at the bottom, just scroll down. Here, you can insert the page number as 1. So that subsequently, when we add up more papers, they will be automatically numbered 2, 3, 4, 5, 6, and so on. Now this, let me zoom out. This becomes our basic template, the format which we will be using again and again for new patients. This has to be made only once and used n number of times. So save this format as a template, go to file, scroll down, here it is, save as template. And there it is, add to template chooser. Okay, then it will ask for a name. See, I have already made my templates. I already made a lot of templates. I'm using this for the last 3 years. So let's call this template today as new patient. Okay, and create. That's it. You can delete this paper. Now, when the new patient comes to your OPD, go to pages, click here, new document. You can go to my templates. I think it is not saved. Oh, here it is. Okay. So this was our OPD template. I'll just log this. Okay. Now when the patient comes, you can fill in this data.
Mahesh, is it possible for you to zoom? On my laptop also it is difficult to see.
Okay, I'll zoom it to 3.
Zoom as much as possible. Yeah, more, maybe more, little more.
Okay.
This is good. This is good.
Okay, so age 50 years, male, weight say 85 kgs. Sorry. Address, yes. Date, you can insert it from here. Telephone number, whatever it is. Allergies, maybe none. Comorbidities, okay, hypertension, diabetes, occupation, sedentary job. This is serial number 1. So see, hardly it takes about half a minute to fill up this data. And then you can always start here, click here, and this will be your the patient's complaints. So just for the tutorial sake, I'll just write the diagnosis. And you can see I'm just typing here, pressing the letters, so left plantar fasciitis. So I'm just typing it LPF, and that gives me the entire sentence. This is called text expansion. We'll come to that later. But this is how I do my OPD work and say treatment, hot fermentation, soft footwear, whatever tablet I want to give, some acidity part, okay, and follow. So let's write some date, say 5th. So that's it. This is how the paper is made. Simple, hardly say 1 or 2 minutes in the typing part. I don't think even we can write that fast, and especially with all the brand name and the generic name, so the ingredients which is required by the MMC. This is my OPD paper. So next will be printing it. So Command P, or in Windows it is Control P, and you print it. Okay, so the hard copy, once it comes, you sign it, date it, stamp it, and give it to the patient. Now this electronic copy has to be saved. Now pay attention, there is a series of buttons which you have to press to save this, and it is command for Mac and control for Windows, and it is go here. The step is first select this box. So it is Command A to select everything, then Command C to copy, Command W to close this document, but it is asking us to save as, so Command B, which is paste. All right, so Command A C W B or Control A C W B, and on the desktop it will ask you where you want to save. So I already made a case paper folder. So I choose the case paper. You don't have to choose this every time. The computer remembers what was the last chosen folder. And so Mr. Hassan Medraha ke OPD paper goes in case paper. So this save. That's it. This is the folder case paper, and this is this paper. All right. Now say the next patient again is a new patient. So I go to OPD, new document. Yes, this was my OPD paper. And say now the next patient is ABC. Date again, I go here. Sorry, let me zoom it. Okay, we don't fill now, just for the time, saving time. So insert date and time. Say the serial number is 2. And here it is. Say tennis elbow, right lateral epicondylitis. That's it. Treatment, hot fermentation, tennis elbow support, I give some other tablet. That's it. Follow whatever 10, 12, 20, 20. And same thing, get the cursor here. Remember command or control A, C, W. It will give us save as choice B. And see, it has already chosen case paper. It just remembers what was last chosen. And then save. Here it is in the case paper folder. We have 2 patients. Now remember, this template has to be used only for new patient. So what if the patient follows up? So let's see, now the procedure a little different. Pay a little more attention. Suppose the first patient that Hasyam Edrake follows up, saying next visit was on 5th and today is 5th. So we search the patient, press command space bar and type his name. Hasyam Edrake. There, just press 2 or 3 letters and there it is. So now you open his paper. Here it is. And now this was his first paper. Now we want to add another paper for the follow-up visit. So you can insert from here. Yeah. You can insert here, section break, or you can press this add page, or you can go from here, insert section. So I go there. So now this was the first page and this is the second page. Now I'll just zoom out and show you. See, the cursor is already starting here because this is the printed letterhead part, the doctor's part. So now we have to insert the patient's data here. So what I do, press anywhere in this chart, we get double circle here. Click on it, right click, copy this, go to the next part, click here and paste it. Now what changes is maybe the date. So like whatever the date we decided, like 5th December. So when we insert from here, insert the date, this will automatically be 5th December. Maybe the serial number changes to 5. And then if it's fine, is okay, no complaints, fine. Treatment will be exercises. And so follow up after 3 months. I print this, but now pay attention. Printing will be a little different. I press Command C or Control P. Sorry, print is Command P. And now see, if we just say print, it will print both the pages. We don't want that. We don't want all the pages to be printed. The first paper is already with the patient. We just want single, and here choose 2 or whatever the paper is, and then print this. So this becomes his second, the first follow-up visit. Sign it, stamp it. That's it. Give it to the patient. And this paper, you can just press Command W to close this. So now if you see this in the case paper, Edrake has 2 papers. We didn't even number this. This gets automatically populated. Okay. So this is for the follow-up. Now let's see how those shortcuts are made. So suppose you want to write something like say Shellcal XT with all the ingredients. I just press SXT and see it expands to this much. I don't think anyone will be able to write this fast and then giving the attention to the patient. Will be wasting time probably writing all the ingredients. That fast it is. Of course, you can make your own shortcuts. These are shortcuts or text expanders, and how they are made in Mac, I'll show you. Just delete this. For Windows users, there is no inbuilt software, but you can use Type Pilot and Text Expander. These are the 2 programs. This is for Windows. They are paid, of course, but they do the same thing. For Mac, You go on to system preferences, keyboard. See, now select text, not shortcuts. Select text. Okay, and these are my all shortcuts which are made. Let's make a new one. I'll show you. Say I add this here. I type BOS. So these are the initials, and I press a Bombay. So edit society. Okay, so let's get added up. Close this. I'll show you this now, how it is used. So now if you type here BOS, it expands into Bombay Orthopedic Society. You can write pages just using few letters. So this is not only 3 words, it could be 3 sentences, 3 pages. Just you have to make sure that you remember the type to expand this text. So that's it. I now invite Dr. Mangal Parihar sir to start his talk.
So in the meantime, Dr. Mangal Parihar shares his screen. Yeah, he started. Okay.
Yeah.
So I'm just essentially going to talk of one sec.
Sir, can you put on your video as well?
Yeah, one sec. I need to. There is. I'm going to have to switch a little bit here and there. Because like you, I'm going to show mainly my screen. But essentially what I'm sort of talking of is you need a standard way for storing images and X-rays. And the way that I do it is by putting in the patient's name, putting in the date of that particular image, and adding particular keywords. Also, the place where these images are stored is a standardized way. I have other colleagues working with me, I have fellows working with me, so everybody follows the same kind of rule. So two sort of different things. You can use what you choose, either first name, last name, or last name, first name. Whatever it is that you choose, you should have the same, you should have the same way of doing it. The second thing which I do differently is the date is always written with the year first, then the month, then the date. We are used to doing DD, MM, YYYY, but we always use this way the full year, month, and the date. I'll show you why that is important, because when you're sorting, that shows you in the proper order. Finally is the use of tags or keywords in all those images. Now there is something known as the IPTC, which you can use IPTC keywords which are embedded into the image. So even if the image travels from computer A to computer B or goes via email or any other way, these IPTC keywords will still be in that image, and they make searching for the image much easier, right? And you can have, you can make your keywords very, very complex, but generally I would suggest keeping it simple makes it easier to use. So like here, for example, this is the way that we rename our clinical pictures: surname, first name, and then the serial number. For example, that is, if a patient came today and he had 10 pictures taken, his name would be there, you know, Patil Rajesh, today's date 010203040506 up to 010. X-rays, similarly, the patient's name, the date of the X-ray, and the serial number. So depending on how many X-rays were taken that day, we do a lot of CIAM, and I use those CIAM pictures to explain the procedure. So same thing, we get DICOM images from the CIAM. But even if you take photographs of the CIAM, you can rename them in this way. After we rename, we crop. After we crop, we tag the images or give them keywords. And then all of these things are stored into a disk station, which is basically a NAS device. If you have a computer and an external hard disk, you may specify that is the place to be stored. For me, images are extremely important, and here you should not forget the importance of redundancy. So you've got to have at least 3 copies of any stuff that is important to you. So I have one on the disk station, which is a NAS which can be accessed by anyone on the local network. In that, there is this Mangal Anand Hospital shared folder in which there is I'll show you that in a bit, and then in the patient folder. So one copy is there. One copy, this works, the NAS has a facility where it automatically can sync to a cloud service. So every time any change is made on the NAS, it syncs those particular files to my OneDrive folder. So I have one copy of the images on the NAS, one copy on OneDrive, and once in a week or once in a couple of weeks, I take a backup on an additional hard disk. So all the documents that we kind of store for patients have got particular directories, and this is actually stuck up on the wall. You know, similarly, the keywords that we use, the things that I use, each photograph or image will have one of diagnosis, one of type, which is clinical or X-ray, one of timing, pre-op, intra-op, or post-op, what treatment was done. So these are the things that I'm kind of usually doing or interested in following, and then the location. Now, here I do a little bit of a shortcut. For example, you can see here there is elbow, and this is radius ulna. Now, if I want to specify that this is proximal ulna or proximal radius, then it would be radius ulna as well as elbow. And if it is distal radius, then it would be tagged with radius ulna as well as wrist. So that's a kind of shortcut. But you can specify every location that you want on this, and then the miscellaneous stuff. So now I'll go back. I'll stop there and share my entire screen so I can show you what it is that do. So for example, here you will find, now this is just a sample which I have, kind of anonymized it. And these are various patients that you will see have been named in the way that I described. So let's look at this. So here, this AH is the name of the patient, 2013 May 04. X-ray 01, right? 2017 November 1601. So when I sort this, all of them will come sorted in that order, either a forward or a reverse order. So these X-rays are before he sort of came to me. So they were just kind of copied from whatever the date of that X-ray was. And additionally, all of these will have the what do you call tags in them. So now if I open one of these in preview, are you able to see this now?
Yes.
Yes.
The X-ray also you are able to see, na?
Yes. Yes.
Yeah. So here in this thing, on the Mac you can see preview, and if you look at IPTC, you will see the keywords X-ray, pre-op, congenital, etc., etc. Right? So this has already got all of those keywords, that because we have added them. So how to add them, I will show you in a bit. But it makes it much easier. Now this is just a small selection. This is only 10 patients. But if on the Mac especially, and even on other things, now if I want to search for JPEG images, say on the Mac I say search for picture, or JPEG. So it's a JPEG image. I know that the patient's name is AH, and so you notice over here, this is already showing me all those, because these things are indexed on the Mac especially. These things are indexed. On Windows also the search does it, but the Mac is almost instantaneous. So now I've got AH over there, and these are all of his images which you saw in that folder earlier. But now I want to see only pre-op. So these are the pre-operative X-rays which I just showed you. Or I'm looking for his intra-op. Now you'll see only the intra-op. In the intra-op, you'll see the clinical pictures. And also so this was a special kind of case, so there's a lot of images, but you'll also see the CIAM images, because CIAM images are also intra-op. But if I know that I don't want that and I say clinical, all the CIAM pictures are gone. So now I have AH, only the intra-op clinical pictures, and you don't even have to type the whole tag if it is unique. So that's the last clinical picture we have of them. Now I don't remember this guy's name, but I remember that it was a congenital pseudarthrosis. So I put congenital intra-op. So I get all exactly the same images. There's one more picture which has come here, which is another patient which is not here. But again, you notice this is an intra-op picture of a patient who was a congenital congenital case, right? So using these keywords, then you don't have to separate these images into separate folders. Say for example, this girl had, or this guy had a bone grafting as well as an Elizarov, and later on he had something else done. All of those images will come into that. So now if I go back to show you his...
Sir, excuse me, the audience are not able to see the tag words. I think that part is very small. Can you enlarge there somewhere?
Does that make it better?
No, not.
One second. I'm not sure how to. I'll 1 sec. Let me just check.
Uh-huh.
View. I don't know how to zoom.
Yeah, this view won't change. The entire page has to enlarge actually.
Yeah.
Then that search part will also enlarge.
Sir, if you basically increase the text size, I think that will help. When you were going in the view option, there was something called as text size. In the view options,
So view options.
text size, you just try to increase the text size as maximum.
That's the maximum.
It helps a little bit. It is more clearer now.
Okay. I'll just show you the same thing again now. So as I said, I'm searching for a JPEG. So what kind of file? I'm searching for a JPEG. Then I'm searching for something congenital. Okay. And intra-op and clinical. Right. So that then shows me only all of these clinical images and additionally that one other patient. But now you notice here there is something else come up. There's another patient. Right. So anything that has got congenital and these tags will come up, and then you are here. I've just put in the initials for purposes of anonymity. But the moment that name is there, and you know, there are often times you try to think, "Arey, uska naam kya tha? Uska naam kya tha?" Then you remember ki sala congenital patient tha, ye tha, and the moment you see the name, it says you realize, yes, this was the patient, right? So now, essentially, this is how we why this helps in searching. But if I go back now to that same folder which I was talking of, so here now I have, if I sort this by name, all his images right from 2013, 2017, 11, 16 was when his surgery was done. Then as his follow-up x-rays and videos also have the same. So this is November 30th while he was still with us. 2018, 2018 March. 2018 he had a second surgery when we took out the fixator and put this thing in. So that is labeled with again C-arm pictures. 2018 when he went back home, he sent us x-rays. So those x-rays go into that. Right down to his x-rays of January 2020. So I have all of his images in one folder under his name in the proper serial order. The only thing is you have to have a regular kind of system that these images will be renamed. So as soon as these images, etc., come to us, they go into a separate folder where they stay till they are weak. You can't necessarily do this every day. So, you know, every few days, one of us will do this. Now our radiology technician is also kind of trained. Even the videos you see, 2018, 10, 22, that's his video of that. That is also renamed in exactly the same fashion. So everything is in a serial order. Now there is a very simple way of doing this. Are you able to see the Adobe now? Or are you still seeing the Finder, Neeraj?
No, we are still seeing the Finder.
Finder.
So you have to share the full screen, the first part. You have to unshare and share the first part, desktop one.
Desktop one. Okay, share.
Now we are able to see. Yes.
Yeah.
Now, if you see, this is a program called Adobe Bridge. This is available in Windows. This is available in Mac also, and it is free, and it's a fantastic program. So here you have the browser which goes into the various folders. So this is the folder BOS webinar which I was showing you just now. This is AH, and let me just, so here now if I click on a picture, you will see all the metadata of this image. Metadata is all, you know, how was this file created?
Sir, enlarge this screen, please, sir. Enlarge this screen.
Enlarge.
On green. Click on green dot.
Click on
Green dot on the left.
Where is the green dot?
There, either red, yellow, green hota hai na upar. Maximize screen.
Left upper screen, maximize screen. Yeah.
Oh, acha, wo wala. Okay. That doesn't make too much of a difference.
Stretch it out, stretch it out. Take your cursor at the edge of the screen there and stretch it out. On the sides, right and left. Stretch it there. Yes.
But essentially, what I sort of want to point out to you is, now, for example, this picture. I have selected the one which is darker. This is AH 2017-11-16-01. So this will, if you look at file properties, it tells you which was the camera that took it. This was a Coolpix S3. The date this was created was 15/11/2017, 16/11. So that's the date that has been given. Dimensions, etc. And then most importantly is the keywords. The next tab next to metadata is the keywords. Now, Bridge has a way in which you can use what is known as structured keywords. Here, exactly the same thing that was there on the on the wall, you can see bone joint, diagnosis, miscellaneous, timing, treatment, and type. So if I go on type, it's either clinical. So this is a clinical, right? So I can choose now, for example, multiple images here and give all of them a keyword from selecting over here. So bone joint, I will say this shows already, this is already tagged, this is tibia fibula. So similarly, all images can be tagged either singly or in a batch. Now, these are all intra-op pictures. So all of them can be selected at one time, and all of them can have the timing changed, the tag for timing changed to intra-op or post-op or whatever. So whenever the images come to us, they are sort of seen in Bridge and they are tagged. Bridge also has a way of renaming. Let me see how I can show you that. So we've got, this is BOS, and here BOS webinar images. So here are some images which have not been renamed. So you can see again here, this is some, I think this was a phone camera, N900, must be a Samsung phone camera image taken in the OT. This one is a tiger photograph taken by Nikon D500, and none of them have keywords. So now I will select all of these, and let us say that this is tibia fibula. So I'm selecting tibia fibula. Okay, this is right only, I think. So you can select all the tags that you need to give it. And one sec, just give me a sec. I'll make those. They are all, I just moved them from the archive, so they are read only. That's why it's having an error in writing to them. I have to change the permissions. So you can add tags to all of this. In Adobe, you can also rename them. So if we select all of these and use batch rename, this is a fantastic tool. You can put in particular text. So let us say that this is patient Shah Rajesh. Okay, and the date and time you can either you can put it, or you can select one of these, the date created. Okay, and in that you can then select which format you want. And as I told you, I use this YYYYMMDD format. Then I put an underscore and the sequence number is 1. So now if you look below here, are you able to see this? Neeraj?
Yes, yes.
Dikh raha hai kya ye?
Yes, yes.
Okay. So that current file name is 2015-02-24. That's the date and time, but it will get renamed to this, and 7 files will be processed. Right. So now you see those files. This one's name has changed to Shah Rajesh 2015-01. I have just, but the dates have changed according to the date that the photograph was taken. This is 2015-02-24. This is 2016-11-02. Obviously, these are two different patients at different points in time. But using that file created date of the camera, you can change it. Similarly, when you use, say, Horos, or in Windows, if you use another one, here I've got a patient who I have 3 X-rays of. And in this, you can export these. So instead of taking photographs of images, you can export all of these as JPEG. and I will save them here because I've already done. So patient 1 new. So Horos in the case of the Mac, or in the case of Windows, whatever you use, Radiant DICOM viewer or micro DICOM viewer, both of them will change it, and you will have so I saved it in this patient 1 new. So this is the patient's name, and these are the various the 3 sets of x-rays that were done. Now the important thing to note over here is there are a lot of numbers over here. 5, 6, 7, 8, 1, 8, 0, 3. If you take out these first 4 numbers, and I'm going to put in 20. This is actually the date, the first 4 and the last 5. This is the date when that X-ray was taken, and the same pattern, this is the standard naming pattern for when they export it. So I put in 20 and the last 5 are taken out. So just looking at the folder, you can say which date this was taken. Now, in Windows and in the Mac, there is a simple way to rename this. If you right click on the Mac, you can rename, and we will say patient 1 201803 27. Then I told you my my sort of protocol is _x_ and I start the numbers at 1. So I rename. So these are all now renamed. So I can take these and folder, right? And similarly for this one here, they are all in separate folders. Just to make it quicker, move all of them into one folder, because to and this one's date was 2008-0301. So I will rename these 9 items. It's already entered there, only this date I have to change. So I am changing that to 01 and start at 1 again. So this is now renamed according to my requirement. You may have your own way of treating it, but essentially you have to have a simple way of renaming, and then all of these x-rays, even if they get mixed up, just looking at the x-ray, you know what is the date. I'm adding it to the same folder, but 2018-0301, 2018-0301, and this was done on the 27th, that is after surgery. Then I can go to Bridge and patient 1 all these images are now renamed, and I can say this is congenital. This is congenital. So I'm clicking that. This is deformity. There's some problem with this thing is acting up right now. I don't know. But essentially, I will choose all the tags and I will tag all of these X-rays in exactly the same way. And sometimes even if your tagging is not absolutely perfect, you know, as long as I can find a few of these images, then I know the patient's name, and then I can search for that. So I think that is basically the kind of concept that I wanted to share, of renaming the files in a standard fashion, either first name, last name, or last name, first name. Adding the dates to all your images and all your X-rays in the file name itself. If you want, you can also add it as a tag, but I find it much more convenient if it is directly in the file name. And then add all the tags that you think are important to you. For example, you know, arthroplasty surgeon might want to add tags like revision, primary, varus deformity, valgus. Multiple kind of options are possible. What you need to search for your pictures is what you need to do. I think that is in terms of the talk that, I mean, what I wanted to share. If there's any questions, then we can take them as they come.
Neeraj?
Yes. So I will start with few questions. I'll start with Swapnil.
Swapnil is not there, Neeraj.
Acha, okay, okay. So I will start with you.
Yeah.
So I would request you to share your screen again and show the text expansion.
Okay.
Once more, how do you do it? Because I think that is the main feature which even everybody can use.
Yeah,
and I have few doubts regarding it. That's why I'm telling you to do it again.
Okay. See, so we start here in...
Just make it full screen, yeah.
Yeah. Go to settings, keyboard, select text here, not shortcuts, text. Okay. Now this is where the replace and with. So suppose like we want to add something. Now say we put IOA. All right.
Can you make this big? No, but
no, this cannot be made. I was trying to do it, but this cannot be made big.
Because it is system preference.
Yeah. So Indian Orthopedic Association. Okay. So this is, then you close this. Now you open any document, not only pages, any document which works on Mac. Then now we have this. Okay.
But Mahesh,
yes,
a problem, because I use this on iOS all the time. So I have shortcuts for sending text messages. When I want to send someone a message of my hospital address,
correct,
I put mah.add,
right,
and that expands to the entire Mangal hospital address with the phone number, etc., etc.
Yes.
So when you have to be careful about those short forms that you use, because now if you want to type that I was invited by the BOS, always expand to Bombay Orthopedic Society, and I have not been able to find a way to escape from that.
No, I'll show you the trick there. I'll show you the trick there. So see, now we have two shortcuts which we have made now. So BOS, so it expands to Bombay Orthopedic Society. Press enter and that is. Then now we made IOA, right? Press enter and that is the expansion. Now suppose you don't want this Indian Orthopedic Association, you wanted to write IOA. That is what you mean, right, sir?
Yep.
So IOA. Now before you press enter or space bar, press some any other button, say P. Now this doesn't have a shortcut. Hit this P and go ahead. That will not give it. Okay, so take me. BOS. You can cancel it from here. 1. That's it. Okay. And in phones, the iOS, you can just take this like BOS here, but here it is expanding. In iOS doesn't expand. You put an extra character
Okay.
and cancel it, and then it stays like BOS. That is how it works.
All right.
On Macs, you can delete it, cancel this here. That is what I do.
So there is one more issue here.
I have another trick to do this.
Okay.
What I do is every shortcut you create with a semicolon in front or a dot in front. So you're never going to write dot BOS or semicolon BOS. Semicolon is a easy thing because semicolon does not require you to use shift key. Neither
Right.
does dot. So you can
Right.
use semicolon IOA and it will be full. So whenever you want IOA, type IOA. And sometimes when you
correct.
want
That
the
is-
whole
that
thing,
is a
type
good trick.
semicolon IOA. So
But the point
all
Chip,
the
is here
shortcuts
is
can make
you
it
will
like
write IOA once upon a time, but all the shortcuts you are having that one extra key to press, with that
Yeah,
semicolon.
but it makes there is a system in place for shortcuts that all your shortcuts are going to be with your semicolon. Don't have any shortcuts that are, so you don't have to remember which ones have semicolons and which ones. That's
Yeah,
what I do.
Obviously,
I
yeah.
have all my shortcuts are with dots, and I use Alfred
Okay.
for shortcuts. So Alfred has a much better organization system
Yeah,
than the,
definitely.
but it's a paid app. But
It's faster than
It is
even.
also
much
Mac only, no?
Yeah, Alfred
it's
is Mac only.
yeah.
Mac
It's
only.
Mac. It's Mac only, but Alfred is a powerhouse for productivity. Means you start everything on Alfred. You want to Google something, Alfred. You want to email something, Alfred. You want to search in Evernote, Alfred. Everything is Alfred. So even shortcuts are Alfred. So it's much faster.
Right.
Okay, so there are some questions on YouTube. I'll just take them one by one. So there was this question by Sita Rama Prasad Yallamachili. He is basically a regular follower. He has asked questions in all the programs.
Good,
So
good.
is there any experience with the software or the mobile app called Pixort?
Never heard.
Yeah, it is a very good app. Actually, I've just downloaded. I've received the invite code from someone, and I plan to use it. It is one of the apps mainly for orthopedic surgeons.
Okay.
It's called PIXXORT. It is
What is it
available
about?
for iPhone and Android both.
So what does it do?
It is for sorting out all this data. It is data management. For
Data?
images, pictures, and also for your patient data.
So how does it do that?
So I have not used it. I've just got the invite code yesterday night.
Okay.
Today I did not get time. I was thinking whether to try and use it, but I couldn't get it. So maybe in a week or two, I'll be able to use it for some days and see how it works.
Okay.
Okay.
I can
So
send
maybe
you the code if you're
give
interested.
an update in the next Technopod.
Yes. So we don't have an answer. How do you, Somesh Virmani asked, how do you add the tags? I think you showed that in
Yeah,
Adobe Bridge.
You are using Adobe Bridge. There are multiple programs which do it, but I find Adobe Bridge to be sort of the most useful, and it is cross-platform. That's number one. On Windows, a beautiful program you can use is Irfan View. Irfan View does all everything that Adobe Bridge does. It's a very, very light program. You can do batch rename, you can do batch keywording, all of that you can do using Irfan View. Those two, I think, are more than sufficient. There may be other programs also which do it, but these are two free programs which do the job excellently well.
Okay. So Dr. Mahesh, can you also show us once more, how do you sort these files out? Means how will you retrieve if the patient has come to you after 2-3 years?
No, that is what I'll show you. You can see, you go ahead, so delete this. Now see, in this case paper folder, we just 2 patients. Now I've been using this pages for last 3 years, and around about 20,000 or something more cases, papers, folders are there.
Okay.
So I just command space bar, it brings up the spotlight. I just type the name or anything which you remember of the patient. So say here we had Seham, okay. And then there it gives us, and then you select that. This is really fast, and it gives prompt results. Say I've been using this in my OPD daily for last 3 years.
The issue is that the question is that what is the file name do you give? If I have two patients of the same name, then how will I search?
That is I write the entire name, the full name of the patient. So there's no question about that. I mean, even if the name of the patient, 2 or 3 patients, they have even the father's name the same, but then that sorts out with 3 patients. I can always see which OPD paper the follow-up has come. But very rare. See, amongst 20,000, only 3 patients which have the same, all 3 first name, middle name, and third name same. We don't have
now
so
with mobile number, Aadhaar card.
You can sort by mobile number also, anything. In fact, I remember.
I wanted to ask you, what do you name the file as?
No, I stick to the name of the patient. No other complicated.
No other things. Okay.
Because, but otherwise, even if you search, say, from now here hypertension, so all those who have hypertension written in their paper somewhere will get sorted out.
Yeah.
So
one point I would like to bring to the audience is that we all 4 here are extreme Mac users, and a few of us didn't have Windows till 1 year back. So now thing is that this function does not work in Windows. The Windows does not have that deep search facility which the Mac has.
Right.
It has developed it now in the Windows 10, which I have started using it recently in the last 2-3 months. It is there, but it is not as good as the Mac Spotlights. Sir, what is your experience? You have some Windows.
Who, me?
Yes. Okay, all Mac.
Yeah, I'm using Windows 10 now. I've got a Surface
right.
7. I had a Surface 2, which gave me problems after 2 years. So I wrote to Microsoft that this is having they had a recall. So I sent my machine in for some screen problem. So I sent my machine in, they sent me another replacement. That got spoiled, meaning that was not working properly. I sent it back. They sent me another one. 3 times I sent the machine, and the 3rd time I said, see, this is enough. Now I've paid good money for this. Please give me a Surface 7. So they sent me a Surface 7 refurbished, but that works fine. It works fine. But so it is kind of getting close to Mac in terms of OS, but still Mac is, all this other stuff, renaming and the searching and all that. It's much better with a Mac.
Agreed.
Okay, so then
it doesn't come even close Windows.
Yeah.
And
people are just struggling with Windows.
Chandak has a question. Dr. Rajendra Chandak.
Yes, he's put it on YouTube also.
Whether there is any this thing.
Any software which can sort the X-rays, which automatically face detection,
like femur and tibia. I guess now with machine learning and AI and all, you will probably get software. I'm not aware of anything at the moment. Maybe this stuff like Pixart may already be doing it also, but it will come. But see, basically, even if you are going to use a computer, we've been saying this now for so many years in the times that we've been talking about technology in orthopedics, that if you have a good filing system, it's much easier to transit to computerized records. Because computerized records also require attention to detail. Now, you will say, okay, I'll put it into Excel, and if you're Pandu, instead of Jagdish, Jagdish, he enters the patient's name as Jagadish, that becomes a different patient. So then you have to have proper, traps to catch, so that you only select from drop-down boxes maybe, or something of that sort. So a good system for filing anything translates very easily into computerization. So I think for this also, instead of just relying on software to do it, we have to have some inputs, and this is stuff which support staff can do pretty well. For example, a radiographer, the younger guys now are using computers. once those rules are stuck up there, it's not very difficult. The maximum he will come and ask you, sir, ये किसका photo है? You know, you tell him ये जगजीवन राम का photo है और क्या उसमें tags डालना है, खत्म हो गया. So that is all. Some of them, even if they are not tagged properly, as long as a reasonable number of Jagjeevan Ram pictures are tagged with congenital and Elizarov, for example, you will come to that name and you will be able to find the others. The goal is always to be perfect, but वो नहीं होता है. थोड़ा ना थोड़ा कभी ना कभी किधर ना किधर mistakes do happen, especially when there are volumes. You know, if people like Chandak and all start doing, he's never going to be able to do it himself. He will have to have people doing it.
And then there is the question from Dr. Jagdish Prabhu, sir, can you please mention few paid software for OPD files and clinical pic collections folder?
There is nothing that I know of which will save it like this. One thing you can do is in your PAC software, you can add comments on the patient's name, right? So every PAC software has got one or three, I think Horos has 3 comment sections. You can add in the comments over there, but you will still need to put in the clinical images and all. You will still need to save them in some form and manner. The PACs will make it searchable. कि जगजीवन राम के कमेंट सेक्शन में तुमने डाल दिया कि कंजेनिटल है, इलिज़ारोव किया है, कॉम्प्लिकेशन हुआ, whatever. So you will find that from the PACs, and then but you have to still go and find images with the name of Jagjeevan Ram. So you will have to have a system for renaming. You will have to have a system for putting dates. I don't think there is any escape around.
I can show what I do.
Sure.
One paid and one free database software I can show.
For images.
Sure. Not for images. Images you have to do what you are doing.
Yeah.
Images are just too heavy for you to put it in databases. It just explodes. The size becomes very big. And the problem means I initially tried to save all my images into Horos. But it is better to store the DICOM images as a folder in the patient's folder, like how you have created, and link the files of DICOM into Horos rather than allowing Horos to store the DICOM images, because Horos doesn't store it in folders. And so it becomes very confusing after you run out of hard disk space or something like that, and you want to move the patient's folder around. So I realized that the hard way, and then I eventually had to export a lot of my patients out of Horos, especially the patients whom I wanted to keep their DICOM images as DICOM instead of putting them as JPEG. So now all my DICOM images live in my Dropbox in a hierarchy of patients that are named and numbered like how you have done. Yeah. But if I can share my screen, I'll show you what you can do with a free. Yeah. So one software is Notion, and Notion is free actually. It recently became free, but if you had a .edu email address, you can get much more functionality. But I think they opened up now, and this is how it allows. It's like a note-taking software like Evernote, but it is much more powerful than Evernote. So this is like the patient database system that I have created. I have keywords in it, which I normally use for tagging patients, like this is an ACDF, achondroplasia. So over the years, I have too many taggings, keywords that I have created for different problems. So I use this same system of keywords everywhere. Even my Mac keywords are the same. And here also I've used the same keywords, and these are the patients. So now if you go to the I know I'm compromising on patient identity because these are real patients, but I'm sure that this patient will not mind it. So I have I have tagged this patient as lumbar disc herniation and thoracic disc herniation. He had both. I can put up the patient's photograph if I have a face I have to remember. Age is 45. I have put in the ID number, the hospital MRN number. I mean, this I do just before like scrubbing in and the patient is getting induced. I just type out everything. So this is only a surgical audit. This is not an OPD audit, and this is only just surgical audit. Who referred this patient and what was the problem and what was the ICD codes. I have put ICD-10 codes as well, so they get recorded ICD-10s. And then you can put the clinical notes and the surgery notes. So if I click here, the whole surgery notes show up. So I have to type in the surgery notes anyway for my hospital records. So I do that on drafts on my phone, and that draft text goes on the hospital record also, but it also lives here in Notion, where my whole operative note is put it here, comes in Notion. And I have all these categories created for complications and difficulty encountered and all those things. If it happens to the patient, I record it. So this is a good way of keeping a self audit, that is on Notion. Notion is completely free. It's a little tricky to set it up initially, but a few of YouTube videos can do that for you. But maybe in the future Technopods, I can kind of show you some basics of Notion. It's much more powerful than just doing the surgical audit as well. But let me show you this this is a paid software called Tapforms. Let me close this pages. So Tapforms is a database software like Microsoft Access was or is for Windows users, but Microsoft Access is too, it's not user friendly at all. It's quite difficult, but this is very easy to use. So this is again my patient database. I call it Horizon Everywhere. And so you can see that this is the list of the patients. So let me go to a very old patient, maybe. Um, so here the same way I have created all these fields, and I can search these fields, and these are all drop down menus many times. So I don't have to think about how they will be. I can put more than one clinical encounter when the patient follows up. I can put in the surgery like a drop down menu and choose, okay, myelopathy surgery, this is what I did, where I did the surgery, what was the ASA grade, and what was this key procedure and stuff like that. So these divisions I have made myself, but this is for surgical audit. This is not for on an OPD basis. For an OPD, I don't need to use it because Reliance has its own OPD system. But let's say I had tried using this. Amit Sharma uses this a lot, and I kind of copied it from him. So let's say you have a patient like this, same thing I have created for this, but you can't really print something like this. So you create a layout, and in the layout I have this my header here, and then this automatically whatever you fill it out in the default layout shows up in your formatted layout, and all you have to do is Command P and this prints out. So this is page 1 and this is page 2. So so that way you can not only keep a system of where your OPD patients records are kept, as well as you can print out directly from this on an A4 page if you on a printer. So I know for a fact Amit Sharma does this in his OPD using Tapforms. I don't have to do it because we have our own EMR, but many practitioners don't have it who are independent in their practice. Maybe they can try something like this. That's it.
Yeah. So my question to you all is that all these things which we have showed is basically a lot of time consuming and a little challenging, is what I have understood for people who have a busy OPD and who are not so tech savvy or not fast in typing like all of us are.
you have to do it one time. So the first setup is the most difficult setup. So you have to think a lot about how you want to set it up. After that, it's easy. And then you need to make it a part of your workflow. You cannot duplicate things. Like if I'm going to put in an operative note in my hospital's EMR anyway, that operative note goes in my record as well. I'm not doing it twice. That's for surgical audit. So whatever clinical note I type, so my clinical notes, even if they are for the hospital, start on drafts on my phone. So if they start on drafts on my phone, I always have one digital copy which goes to the hospital EMR, but it also goes to my EMR. So I'm not duplicating anything. I just have to do it consistently, at least for the surgical audit. OPD audit is very hard. OPD audit is very difficult. OPD is real time. If your OPD is, you are doing it like on pages like Mahesh is there, then only you will have a copy with you. Otherwise, you're not going to have a copy.
For OPD, like I'm using Practo.
Yeah, so you use Practo
is-
otherwise. Yeah.
Yeah, so that is, I mean, it has its negatives, but overall, for use, it is okay. And most of these softwares, you may choose a particular one. We'll have various templates where you can tick and do stuff like that, which is okay for. I think today most people should be able to use some form of software which will give them retention of data as well as presentation of data, in the sense that you want to give the patient a printed prescription, a printed things of what you saw, what you did, etc. Most softwares, I think, will do it this way or the other.
And more than that, I think your productivity increases. If you have set up a system like what Mahesh has done, then the speed with which you create these records is much faster than having to type out, ultraset 3 times a day and this and that.
And
And
then writing
it's
generic
just too
page
much.
is too much. So this
Yeah, so if you have templates, your productivity increases.
Like,
You will
for
be able to
example,
see more patients in your room.
in Practo, to what Mahesh was saying, that we are supposed to now prescribe generic. So all my templates are generic, and in the notes of that particular drug, for diclofenac we recommend Vovaran. I said, but the prescription is diclofenac.
Right.
So that takes care of both the things, that we are giving you a generic prescription. We are also telling you what we.
The advantages of pages, why I started using this, or what I was using earlier, even the digital pen and all. Once it is with iCloud, I get these pages, the patient's data on my iPhone and everything, all Mac products. Now the advantage is that if I'm outside and I get a call, so patients do call with yeah, pila goli se allergy hua and all that thing. You don't remember this pila goli and nila goli kind of thing. So just find out this paper. There's a paper in front of you, and then you really go through the medicines and then give the correct advice.
Yes, but most software today is, especially which is on the cloud, you can do that for everything. Like
Mahesh, let me tell you an extra advantage of the Practo. When the Practo, if you are using an Android phone, at least when you're using an Android phone, I'll tell you both, Android and iPhone both. I know you're not, even on iPhone. So Practo, if your patient you have entered in Practo, Truecaller पे उसका नाम लिख के आता, Practo में मतलब लिख के आएगा कि this patient has, this number is registered with this Practo caller ID and उसका नाम ये है. That is one advantage. Second, on the Android, तो डिटेल में लिख के आता है, अगर मैंने उसका फोटो निकाला तो फोटो भी आएगा, and at the same time last appointment कब था वो भी लिख के आएगा.
अच्छा, okay.
And you can of course check all the prescriptions which you have given. So that is an advantage of a Practo, because
they have developed the software. See, this is what pages are not meant for a OPD kind of paper, but this is how twisted it to suit our usability. So with pages I'm very comfortable with everything. I can search any word, whatever I remember, the drug name, this, that, and the whole data stays with me. If I want to put it on cloud, fine, that's a different story. But primarily the data is with me. That's the whole advantage. It's free. It's inbuilt. It's free. And now new things are coming up. In fact, I can put a MRI report or blood test and this all in that OPD paper itself. So even in the next visit, follow-up visit, if the patient doesn't get his OPD paper, no harm. He doesn't get his MRI, no problem. I can just read his MRI report in the previous page, and that is it. How it is done. Should I show that small trick? Two
Yes,
minutes.
why
I'll
not?
show you that. Say this. Okay, suppose we go with the same patient here. Now say this was the first visit. Okay, here we want to insert an MRI report or blood report, anything we want to say. So what I can do is I start my phone, and this is the paper. This is not actually an MRI report. This is a life certificate, my mother-in-law's life certificate. So, but the idea is I just take a photograph by, go to insert from iPhone, take photo, click on that. So my phone now becomes a camera for my iMac or MacBook, whatever I'm using. And then just click a photograph, and there it is, use photo. This photo is not stored in my iPhone, so no question of privacy issue here. And the whole, I'll just zoom out. And that's it. This picture comes here, assuming this is an MRI report. I drop down into, very small size and just put it anywhere I want. Now, if I print this page, obviously the thumbnail is not going to be seen by anyone. No one can read it. But the idea of this is, next time when the patient comes, before he enters the OPD, what I do, I go to his previous page and suppose, okay, I'll just save it. Okay. Now Hasyam again comes back, OPD follow-up. So I get this paper here. And that's it. So before he enters the OPD for the subsequent follow-up, what I do is, I'll just enlarge this. What I do is, I just enlarge this photograph quickly, read everything what is there, what I want to read in that, and just press Command Z, get back to the original size, and I'm ready with his next paper. This trick I use often with reports and MRIs and even X-rays. Sometimes I photograph it on my screen and then put it here. So I'm very comfortable even if the patient comes empty-handed and they want to know his history before really I start talking to him. This is the trick which is available now with. I think it is only
that is available if you're using the full ecosystem.
Mojave, yeah, it's with Mojave. That is how it is.
The handoff is there everywhere.
No, this is not handoff. This is not handoff.
Sorry, the takeoff.
Or
handoff also works similarly, but you can.
Yeah, it works similarly. So that is another advantage of using the Mac system. I don't know about other Windows or any other software.
We'll just, so what we'll do, it's past 11. We'll just take one or two last questions. I think Dr. Mangal Parihar has already answered. So Kshitij, Ranjit has one question, which I answered, but you tell me if your experience is different. Any reason why you use Dropbox for storing of patient images as compared to iCloud or OneDrive?
iCloud, the file system is not so good as Dropbox. The searchability and all. I find iCloud is still evolving. Dropbox was the primary one which exploded this market in the first place, and they are way ahead in terms of functionality and selective sync and all. iCloud just tries to make it easy for the person, but it doesn't give you that much power, whereas Dropbox does. So
when iCloud till recently was person-centric, which carrying it widely and all was used to be difficult.
Not there.
Now it's I think in the last 2-3 months what has made it that it is approaching Dropbox.
It just started.
Dropbox has had that for a long time. Probably they are more.
Dropbox, iCloud doesn't allow you to selectively sync. So if you have an iCloud stuff on iCloud, your operating system will decide, depending on the usage of your files, which ones should not live on your computer and live on your iCloud. But let's say if you want the last 2 years of your patient records to always live on your computer, whether you use them or not, then iCloud will not let you do that. So Dropbox lets you do that. So what I do is that the last 2 years of patient records always lives on my hard disk. So I don't have to download them to see them. They are always there. And that's called selective sync. iCloud doesn't let you do the selective sync. And the other thing is the search within the Dropbox app itself is much better than iCloud. I mean, iCloud now, the Files app and all on iOS includes Dropbox, so it's not so much of a difference. But in terms of functionality, Dropbox I think still is the leader. Maybe Google Drive is close by, but I mean, Dropbox is way ahead. In terms of integrating with other softwares also, Dropbox is much better.
Do you have any experience of OneDrive, sir? You have?
I have none.
I'm using OneDrive.
I'm already.
I use OneDrive.
I'm spending 77,000 on the subscription I've calculated, so I'm not going to buy anymore.
It has come down to 77,000 now. It was 30,000 1 year back.
I know it's increased.
For what?
Per year. His per year cost of all subscription software.
Acha. No, I use
Netflix.
OneDrive.
That includes Netflix also. Netflix
it includes
itself
all sorts of weird things. Yeah, it does.
Pornhub premium channel.
Yes, it includes everything. So it's not just orthopedics. It includes
Basically, online credit card bill.
Okay, I think we will close the meeting now. It's almost 11:10. Thank you, everyone.
Thank you. Thank you.
you.
All right.
Let's meet again next month. It will be Christmas time.
Around Christmas.
Yes.
Right.
Bye-bye, everyone. Thank you for participating.
All that stuff
Good
is
night.
online. Whatever that last comment was, it's live.
Yes.
And
You
right.
can
Yeah, but
stop the streaming. You can stop the streaming. It's all right.
That was the allegation for you, though.
I know.
We are all innocent.
Stop the streaming.
Stop the streaming. Wait a minute.
And you have to end the video also, both.